Welcome back to Tales of Truth podcast, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my co-host, JoJo, veterinary nurse extraordinaire. And today we are doing our part 2 of kidney disease in cats.
Yes. Couldn't cover it all in one episode. So
We
if you
couldn't.
haven't heard the first episode, go back and listen to that one first.
Yes. Fiona terrorizes the beginning a little bit, and it turns out we recorded the whole thing without the right microphone. It's going to be okay. But if the sound quality is different, we can thank Fiona for that. But there was so much...
Fiona's the cat. Fiona's the cat.
Fiona's the cat. She's behind me. If you're listening to us, you can't see her, but her picture's behind me if you're watching. It's this. She's mischievous, just like she looks in this photo. So there were so many things we could not cover. We did cover a lot, like how to get your cat diagnosed, how often to do blood work. We talked about hypertension a lot. I feel like we talked about hypertension so much we don't need to talk about it again. Don't you think?
Oh, yeah. I think we covered it in length all the way down to our favorite Doppler.
Yes.
Our
You'll
favorite
now
technique.
understand how we prefer to collect blood pressures from cats and exactly how we do it. So what are we going to talk about today? Food, right?
Yeah,
Diet.
we're going to talk about diet. We're going to talk about treatments. You had some notes about anemia and phosphorus, so I'm going to put that on your...
I forgot about that.
Yeah, I thought you might.
I know. So JoJo and I do this unscripted, but today, because we are doing an episode with all the medical things and we want you to have like a complete kind of guide, we took notes of like, okay, we can't forget to mention this.
And by notes, we have bullet points, but not a script.
No.
And Fiona,
script.
last episode, is just so much evidence of how unscripted.
It's also unscripted.
This is. But it's still, I mean, the important piece, the important information is getting out. So we have diet, treatments, anemia, phosphorus. We have hypertension on the list, but we're go back to episode 1.
Go back to episode 1. Everything you need to know about hypertension is there, even how to treat it.
Yeah.
But what I really want to talk about is food, because this is what happens. People take their kitty to the vet. They do some blood work, which is great. And their veterinarian finds increased BUN and creatinine, or just increased creatinine, and says, hey, your cat has kidney disease. Here is this prescription diet. And I can't tell you how many emails, calls we get of like, do I really have to feed this food? And the short answer is no, but it might be beneficial in certain situations, in certain stages of kidney disease. And I'm going to share my opinion, which is not an opinion shared by all veterinarians. And so if your veterinarian says something different than what I'm going to tell you, it's not that they're wrong. And I just want to add this, they are actually not making any money on any kidney diets. Most clinics don't carry prescription diets. But even if they were, I promise the markup on pet food is awful. They are only doing it to make your life easier. But for the most part, veterinarians don't carry food. And I promise there's not really skin in the game for them.
I'm going to challenge a piece of that. Is it true that I believe all of that. I believe that there's, not a big financial markup. Like they're not getting kickbacks and commissions on prescription foods. But do you think, or my question is, could it be more that it's the easy answer or what they know to be true? And so diet is such a ginormous umbrella of opportunity that sometimes maybe prescription diet is easier.
Yes. Well, it's my opinion. This is going to sound so snotty and I don't want it to, but I'm just going to say it. And maybe that softened it a little bit. I think some veterinarians prescribe kidney diets in what I consider to be an inappropriate time due to a lack of critical thinking. And it doesn't mean that they're not critical thinkers, but I disagree about how they're approaching nutrition and kidney disease. So I'm just going to come right out and say that. And I don't think they're bad veterinarians, because I think it's most veterinarians, but I think we're missing some nuance that is not being missed. Like if you go to an internal medicine conference, they are not missing this nuance. This is being discussed. But I think sometimes when you boil it down to a general practitioner, which I am one of those, it's easy to just be like, okay, cats and kidney disease, feed kidney diet. move on to the next thing because we have a million things we're thinking about. Because we're also thinking about your cat's oral health. We're thinking about your cat's weight. We're thinking about your cat's heart murmur. And so sometimes I think it just gets too distilled down.
Well, yeah, I feel it's just one of those line items in which there's just not enough time in a general practice to dive deeper.
Yes.
And so the easier thing is to write a prescription for the food.
For the food.
Yeah.
Yes. Because what we know is that your cat's kidneys in kidney disease benefit from having protein and phosphorus restriction. So we know that cats feel better and live longer when we restrict those nutrients. The problem is that cats are obligate carnivores. They absolutely must be eating meat, which is high protein. And so when we use kidney diets that are phosphorus and protein restricted, we are not feeding them a balanced diet. And so when we start, when your cat is in stage 1 or 2, iris staging, we talk about that in the first episode, we will likely be feeding this diet for years and years and years. And I don't like that because I don't want my obligate carnivore patient eating a low protein diet for all of those years. So I take a more moderate approach and I start protein and phosphorus restricting their food in stage 3 so that I'm still getting some of that benefit, but all of their other organ systems and musculature had the benefit for all those years. So it's like I just kind of meet in the middle. And for some cats, they don't want to eat a kidney diet. And I don't ever make them because I think food and quality of life go together. I think you should like what you eat.
Right. Well, and a majority of those prescription diets, are the renal diets canned food or are they kibble?
They're canned and kibble.
Okay. I just wonder how they're justifying the kibble in a disease that requires so much hydration.
I don't know how we're justifying kibble for cats at all.
Okay. I was trying to still stay.
And I guess I'll just say this. We need a whole episode on kibble for cats. I Texas A&M trained over 20 years ago now. We were taught that just traditionally, like allopathically, like not any this was not an alternative thought, but we were taught that cats should not be eating kibble. And I don't know if we had more of a nutrition focused education because Texas A&M is home of one of the best GI labs for cats and dogs. Like that's where a lot of the innovation was happening. But when I got out into the world and moved to Colorado, and of course, like everyone here is a CSU grad, everyone was feeding kibble. And I'm like, what is happening? And so for me, it doesn't even I don't even know that my aversion to kibble has anything to do with my alternative, holistic, integrative leaning.
Interesting.
Yeah.
Rather than your education.
Yeah. Like it's just, that's what we were taught. But we should have a whole episode on that. So, but if you have a cat with kidney disease, that means your cat's likely older. If your cat does not want to eat wet food and is eating kibble, it's probably not the time to fight with them and have them do something new. And so some cats will only eat kibble, and calories are king. And so whatever your cat wants to eat, that's what I want your cat to be eating too. If, we're not starving cats out. It's just not going to happen. Right. They're going to win. They're going to starve themselves to the point where they get like fatty liver disease and have to be hospitalized. So we're not doing that. So I don't want you to feel like, if you have a 17-year-old cat that's in kidney failure and you feed them a kibble, it's totally fine. It's totally
I heard you. Yes. Totally fine. Yeah. It's a fine line to have a strong opinion and not shame, right? Like it's okay.
Yes.
That I'm just surprised that the prescription formulation for a kidney diet, specifically kidney disease, is kibble. Yeah. So that was one of the questions. So diet is so nuanced because one, you have a lot of players in the mix, right? You've got what your desire is, you have what your cat's desire is, financial resources, like diet is palatability. Like there's just so much. And the good news is we have so many options. But what I hear specifically for kidney diet from you is you pause on restricting the protein and the phosphorus, because if you are restricting that too early on, are you causing other potential issues for your cat?
Yeah, like muscle loss. So we have already senior kitties, most likely, that are struggling with their muscle loss. They're having some arthritis. And I feel like, no, I don't want them to have more muscle loss and get around, have more pain because their joints are less supported by muscle. So we know they're having more pain. And it's just, so I choose to not do that, which is controversial. This was a long time ago because it's 2025, but in 2016, I attended the internal medicine veterinary conference when it came to Denver. And I think there were 2 or 3 discussions about when we should be restricting protein in cats with kidney disease. And it was a panel discussion. It was so interesting. And I think there were 5 different internists, and everyone had their own take. There was no consensus of this is when. And so it gave me permission to not feel guilty. I'm not recommending kidney diets for cats with a creatinine of 2. I'm just not going to do it. And now if someone can present me with evidence that tells me that that's the wrong thing to do, I am so open. But a lot of these papers are not looking at just that. And then what happens when we feed these protein restricted diets for years, and what other kind of like comorbidities are happening, and all those things are so hard to control for. Like you said earlier, it's complicated.
Is there more that you want to say on diet and kidney disease? I mean, because I feel like that in itself is a whole topic.
I know. Maybe we should make a whole episode.
And it's not like, I don't think there's a one size fit all answer for this.
Then you have cats with IBD and kidney disease. And then you have cats with urinary tract issues that are on a special, diet to prevent crystals. And then they have kidney disease. And the prescription food companies are doing their best to be like, we made a formula to try to accommodate both. But at some point, you can't accommodate everything. And I think that's okay. And so I want to just give everyone the permission to not feed a renal diet if it doesn't make sense. It's okay. It's not a big deal. Feed your cat a wet food if you can, but it's not the end of the world. Like, I'm going to give you permission. And if your cat doesn't eat the renal diet because it doesn't taste as good, and some cats are like, I'm not eating this. No, thank you.
It doesn't smell as good. I don't know.
No,
there's
because
like
protein tastes good.
Yeah, it's not fantastic. And there are some cats who love it.
Some cats love it. And when cats love it, I'm like, go you. You're making that choice.
Yeah. I know. I feel like it always comes back to that. Like, you as a guardian really don't have any say in this. You get to present options, a buffet of choices, but ultimately the Fionas and the Fritzes of the world get to make the final decision.
They're making the final choice.
It's so like parenting. Like, what control do you really have?
Oh my gosh, that's true. Feeding cats is like parenting. I think that's the new quote. What control do you really have?
None. It's all perceived, and then they just laugh in your face.
Totally.
Okay, so diet. Do you feel complete on the diet?
I mean, never. But if you want to talk about your cat's diet, then go to our website, boulderholisticvet.com, and go to the consultations and book a time with me. And we can go over your cat's diet and go through everything, because it is so nuanced that I feel like I can make some generalizations, but it's helpful to know more about your kitty.
All right. And for those that are raw food feeders, there's a prescription raw food for kidneys now, right? Am I right?
It's called Medicus.
And I bet a lot of veterinarians have not heard of this.
No, nor would they support it because it's raw food.
Right. But I know, but that's where you have to come in, and like, this is what we hope our episodes help you as a listener to do, is have the information so that you can advocate for what aligns with your values.
Yes.
So there is one out there.
There is. It's protein and phosphorus restricted. And it's a freeze-dried raw diet.
Have you tried cats on it?
I think I've tried 3 cats on it, and one liked it and the other 2 wouldn't eat any of the kidney diets. But like, historically lifelong picky eater, this kitty.
Yeah.
Anything other than what she wanted to. And that's what she ate.
Just, there's so many options. Just so many options.
Yes.
So So just because someone says prescription diet doesn't mean there aren't. And I think Google has got to be a scary hole of options. And if you have a panel at an internal medicine place, all with different opinions, I can imagine what Google presents as somebody who's trying to figure this out for themselves. Don't do this alone. That's what I'm trying to say.
We're here to help you because you can find stuff on the information to tell you you're terrible and stuff to tell you that everything you think is right.
Yeah. It's endless. That is endless. Okay. So, but what we said in episode 1, or what you said, hydration is, calories are king, but hydration is also king. So, what about a very common treatment is subcu fluids or subcutaneous fluids?
Yes.
And
this is
when
so
do you
important.
start that?
I usually start subcutaneous fluids when either my phosphorus creeps up out of the normal limits, because again, like we talked about in the first episode, the kidneys are filtering out the blood and you should be peeing out that phosphorus, but you're not. And so it's building up in the blood, and that makes kitties feel poorly. And so if the phosphorus is increased, or if my creatinine is in the 3s and maybe my patient's starting to not feel good, I will have my clients give their kitties fluids at home. And for the most part, I would say most cats do really well once everyone figures out the routine. It's a little rough in the beginning because you're learning how to poke your cat with a needle and fill the space in between their shoulder blades with fluid. But it helps so much. And I'll usually start out like 2 times a week, and then we'll go to every other day. And in end-stage kidney disease, usually we're doing fluids every day. But man, it can make such a difference.
But it is so intimidating for somebody who is not in the medical field. It's a fairly large needle. Even you and I use a larger needle than you do.
I know.
And yeah, but it's a really inexpensive way to help your kitty. And there are in-home nurses or even your vet team who can come in. Sometimes a techs from a clinic will come in and show you how to do that at home. And once you do it a couple times, I promise it gets so much easier.
Yeah, it's just fumbly. It's fumbly for your cat because they're like, wait, what's going on? But once your cat figures it out, usually they kind of settle into it. It's fumbly for you because suddenly you're doing what we're doing in a clinic. You're dealing with a needle. You have this bag of fluids with this line with all these like levers everywhere. It's kind of got an intense curve. But once you do it, I don't know, what do you think? 2 to 3 times?
Yeah, I think
then you're like, oh, okay, I've got this.
I mean, because at first it can feel like, oh my gosh, this needle, and you have to find a funny place to hang the bag at home, like on a shower rod or somewhere higher than you. And I mean, it can feel scary that there's this big old lump of fluid on that migrates, so sometimes it might have started out between the shoulder blades and ends up in the armpit. And sometimes leaks.
Sometimes it leaks.
Yeah.
It can come right out where you put it in, but not very much, like not all of it. And then it's going to go down your cat's arm in a strange way. Now, they don't care about it, but it looks funny sometimes.
Yeah. And we project all over that it must be uncomfortable or, I remember I would try to get my bag temperature to just the right temperature. Like cold fluids probably don't feel good. And I still believe that, actually. I think a warm bag is probably nicer.
How do you warm your bag up?
Just in a bowl of water.
Oh, that's a good idea. Like just a baby's bottle.
Exactly like that.
Okay.
Yeah,
see, I would be paranoid.
A little less shocking.
Make it too hot.
Oh, no, you can test it on yourself.
You can just test it. Okay.
Just like a baby bottle.
That kicks off my anxiety.
Yeah. Don't boil the water and then put it in your cat.
Yeah.
And then say that JoJo said.
Don't
microwave it.
Don't microwave it.
Just room temperature is perfectly fine.
Yes, totally.
Okay, fluids. What other kind of treatments are there for kidney disease?
So you can do phosphorus binders where you give your cat a supplement and it binds the phosphorus in the intestines so before they can absorb it. And I think those can be quite helpful if your kitty will eat them. And there are several different types of phosphorus binders. You should try them all, but I think that they can be quite helpful.
Do you advise that be done under the care of a veterinarian?
Totally.
Okay.
Yeah. They'll help you like figure out dose. Although rarely do I have a cat that does their full dose of phosphorus binder because it's a powder. They're usually pretty powdery. And so, but not all. I don't think all of them are powders, but I think that your veterinary team's going to tell you based off of how high the phosphorus is, how much you should be giving.
Right. They might have to recheck before that 6-month period if you're using phosphorus on a regular basis. So would you do that though if you were not restricting phosphorus and protein in a diet? Is that a good time to start, or is it later?
I mean, if we have high phosphorus, at that point, we're really trying to restrict in diet. But if the cats aren't going to let us, if your kitty personally is like, I'm not eating a kidney diet, then we do phosphorus binders. But we can also do phosphorus binders on top of low phosphorus diets.
And is a kitty feeling bad when they have a high phosphorus?
Yes. The high phosphorus feels bad.
Okay.
So we want to make them feel better. That's why I'm not against, a lot of integrative vets are like, I'm against kidney diets. And I'm like, I'm not against anything that's going to help my patient feel better.
That makes sense.
Yes.
Okay, so we have phosphorus binders, fluid therapy. We talked about amlodipine in the first episode, which if your cat becomes hypertensive, we can treat that hypertensive, meaning high blood pressure.
Yes.
Okay,
and we talked about our favorite supplements. We went in depth about what supplements I recommend, so go back and listen to that episode.
And they all come in a bundle on our website, so
yes,
you can find them there too.
Yeah, go to boulderholisticvet.com and then go to our shop, go to bundles. Although, so we're going to rebuild our site. It's happening right now. I don't know if will the bundle section stay? I don't actually know this.
I don't know.
So, the bundle will stay, but right now we have a category called bundle where you can find it, but find it. So if you forget everything we said, or you don't want to go back to the other episode, you can go to is it called a feline kidney bundle? Just type in kidney bundle to our website.
Yeah, you'll find it.
Yeah.
So great. Okay. And then the last thing you had on your bullet points today was talk about, well, you had end of life, but I wonder if you want to talk about quality of life before end of life. Yeah.
Yeah. I feel like they go together.
They do go together.
They're intertwined. And cats that succumb to their kidney disease often have such a slow decline. It's hard for people to decide that it's time to send them on. And that's assuming that you are going to euthanize your kitty, give them a peaceful death. Some people would rather hospice their kitty and let them die without intervention. And so either way, it's important to have your veterinary team, like good communication with your veterinary team. Like, hey, I'm not going to keep doing fluids and I think this is the end. And start talking to them about euthanasia, whether it's going to be in the office, whether it's going to be at home. I feel like those plans are best made ahead of time if you have the luxury to do that.
Yeah. And what does a quality of life decline look like in a kitty with chronic kidney disease?
Yeah. Kitties with end-stage kidney disease have a lot of toxins in their blood. So they get nauseous. They vomit. Sometimes they can even get sores in their mouth. They definitely don't want to eat. They don't groom. So they're feeling pretty poorly. For me personally, with my own kitties, when they stop eating and they're not responding to interventions like subcutaneous fluids and there's nothing else I can do, that's when I call it quits. Or if I feel like they're suffering before that. If your cat has so many toxins built up in their blood that they're having sores in their mouth or really bad breath, I feel like there's almost no chance to come back from that. And that's also when I say it's time to let them go. I feel like eating, being able to use the litter box, it's really important. Cats don't really want to go outside the litter box. And so if they've always gone in the litter box and then suddenly they're not, or if they're so wobbly, a lot of kitties just kind of waste away with kidney disease and they can't even walk in a straight line. Those are times where quality of life has declined too far. What do you think?
I think you nailed it. I think the nice thing about kidney disease is you're seeing that decline happen most likely because it's been happening over years. So I feel like there's more time to be prepared.
There is.
So I feel like the gift in that is you often have the choice to call in an in-home euthanasia. That's the gift, right? Like there's just more choice in that transition period.
There is more choice.
Yeah. But I'm with you 100% that kitties don't want to be urinating outside the box. I mean,
No.
it's never intentional. I mean, at that stage, it's not intentional. There are times when cats definitely do
Another
intentionally.
episode. Yeah.
Yeah. But not in this situation. So, and the eating piece when they don't want their food anymore. I think that's
Yeah.
a good clue.
It's hard to come back from that one.
Uh-huh.
It's hard. And, we do all these things that we can help control nausea. So we've got Serenia. We have appetite stimulants, and you can do all those. And at some point, they stop working.
Uh-huh.
And that's usually when you've run out of treatments, it's time.
Yeah.
Time to let go, which feels awful. And I just want to say, I know we had a whole episode about end of life care, but it's really hard when it's your own cat because you're so close. And I really recommend people get outside opinions, whether it's a friend or a neighbor, a veterinarian, just to help them. Because I always know when it's me, it's awful. I'm just going up and down. I'm riding the roller coaster. It's now, it's later. What do I do? And it feels like such a heavy responsibility. And so I encourage people to get other opinions.
Uh-huh. Yeah, I think it can still be challenging to come to terms with the end, even when you have known the end is coming for years, when you've been treating this disease for years. It's still always challenging too.
It's sometimes just impossible. And then I always tell people this decision makes itself because you think, how am I going to know? But you do. You do know. It just suddenly happens.
Yeah, it's less about knowing and more about accepting.
Yeah.
Which is, if I ever become that enlightened, fantastic. It's not going to happen in this lifetime.
And I'll say, if you're listening to this because you're in the stage where you think it's time to let your kitty go, it is an act of love. Euthanasia is, having a peaceful death is a gift that we can give our kitties.
Yeah. Oh, I feel like we should end there because it just feels heavy. Well, because it's been a week of loss, right? So.
Yes. So we lost a patient this week to kidney disease that we have been seeing for years and years and years. And so we all feel sad. And she lived for years with her kidney disease with great quality of life. So, but I would love to help you with your kitty's kidney disease. And if you go to boulderholisticvet.com and go to courses, you can download my pre-recorded class on my holistic approach to kidney disease for free by using, is it TRUTHTAILS?
It's TRUTHTAILS.
TRUTHTAILS. I always have to ask because I can't remember. And we would love to hear from you. So wherever you're listening to this, YouTube, Spotify, wherever, please leave us a review if you have time. That would be so great if you could. Or leave us a comment. We want to know what you think. We want to know about your experience and what you want to hear more about. Anything else, JoJo?
I think that's good. I always say no, and then I say one more thing.
Okay, here's your one more thing.
Okay, my one more thing is, well, it felt like a sad ending. And I just want to remind people that just because your cat has a kidney disease diagnosis doesn't mean the end of life is here now.
That is correct. Yes.
But there's a lot of years of support that we can offer.
Absolutely. Okay, we'll see you next time. Bye.
Bye.